Okay, and I would now like to introduce our final speaker of the day. Lara Chappell is the Communications Director at EURORDIS. Her responsibilities include managing external communications concerning EURORDIS' activities and press relations. She is also responsible for all Rare Disease Day actions which EURORDIS coordinates worldwide. This includes producing the official communications materials and organising the participation of the network of patient organisations. Lara came to EURORDIS after 15 years of experience in the private sector, including extensive experience in communications, marketing, sponsorships, and events. Previously, she was a spokesperson in France and in Europe for the US National Basketball Association. The move to an ONG in rare diseases was obvious for her, allowing her to bring her personal experiences to serve a cause in her professional life. Lara's oldest son, Pierre, age 9, is living with the rare disorder Angelman syndrome. She holds a Bachelor of Arts from the University of Pennsylvania, as well as a Master's of Business Administration from HEC. Lara is American and has lived in Paris since 1991. Welcome, Lara.
How many people in this room would like their organization would like to be able to fundraise more? How many people would like the media to talk about them more? How many people, yes, how many people would like to have things to talk about on social media activity and people commenting, participating? So I hope you'll listen to my presentation. Today, I'd like to help you first give you step-by-step tools to create an awareness campaign, either at the local level, national level, or international level. I'd like to give you ideas how you can use campaigns that are already existing, like Rare Disease Day that I manage. I would like to show you examples of how patients, yes, with very low budgets, with very simple tools, can lead awareness for a cause. And finally, we've been talking about some social media, working with the media, which can fill both short-term and long-term goals. But having an awareness campaign is really for long-term goals. I mean, if the disease that you're representing today is going to be around for a while, which I think it is, hopefully we'll find more cures. But this is something that's going to take some time to start up, and but year after year, if you're looking to be working and communicating with patients, with your members, with organizations, this is something you need to look at the long term. Now, which rare diseases have an awareness date? Do any of your organizations have a specific day for your disease? Okay, some of you do. Now, are those official? Are they not official? And that's what I was saying earlier. I don't think it's that important. There are some common diseases, of course, that are official WHO, World Health Organization days that are known worldwide. But, for example, Rare Disease Day is not, and I think most of you have probably heard of it. Okay? Are the days international or national? And I think something if you don't have an awareness day that you're aware of yet, and you want to look into what you can tag on to or what you can create, if you're looking on the internet, I think it's very important to look and see who is behind that International Awareness Day that you want to use the materials for and that you want to promote. For Rare Disease Day, it's EURORDIS, who is a patient organization. But it's not always patient organizations who have created awareness days. I think it's important that it be a network of patient organizations that have created it, that it's patient-led, and there are not private company ideas or interests necessarily at the base of the day. Just if it is that, if it is run by a private company, you just need to understand why and what their goal is, and use it for your needs, but protecting yourselves and your members. Does that make sense? Okay. This is a link from Rare Connect, which was mentioned earlier in the social media presentation. Rare Connect is a website for patient communities, and they have put together a list of all of the awareness days that they have found. I don't know if these presentations out there will be shared, but you can use this link and go and see. Again, some are official, not official. Some are patient-led. Most are, but you need to look into it before you latch onto it. And then Rare Disease Day. These are some pictures then of some of the events that went around Rare Disease Day. I would like to be able to take credit for Rare Disease Day. It's been a success beyond what EURORDIS and Jan Lecam, who originally created it, would have ever imagined. And again, I can't emphasize enough these little means that were used, and it was just a question of some smart ideas and organizational means to get it started and get it to where it is today. Also, some key elements which you learned earlier were the social media campaigns tied to it and the media interest. Rare Disease Day started, we've just finished the 8th edition, and it began in 2008 with only 18 patient organizations from 18 different countries. And in only 8 editions, we are now, were events held in worldwide in over 80 countries by hundreds of patient organizations, thousands of events, hundreds of thousands of people, media awareness, a lot of work for me, but it's been just every year we're shocked by the number of emails we get, the amount of coverage, and the amount of attention that Rare Disease Day can bring to the cause. Our keys to success, we feel now, was that from the beginning, again, talking about these important smart decisions that were made long before I got to EURORDIS, the first one was creating this network and empowering that network of patient organizations to decide the marketing ideas and the marketing and the communication campaigns. So it's those patient organizations that spread the messages and the communications materials, and they participate every year in a democratic fashion to deciding what the annual theme is and what the slogan is. We hold meetings, and anyone can write to, any of you can write to rarediseaseday@eurodis.org and give your ideas of what the awareness campaign should be talking about next year. EURORDIS, again, the original staff who created EURORDIS, and together with the national alliances, the 18 national alliances who started Rare Disease Day. From the beginning, there is never a private company logo on any of the international materials or the website or the social media that we put and make available for patient organizations to use. Now, why is that? Because we make the awareness date available for all of you to be able to use and fundraise with locally and nationally. We give it to you so that you can find your own partners. You can use this day to build for your own organization, your own disease, and your group. We make the logo available on the website, as well as all of the materials. We do have rules because we own that intellectual property, and those rules are that the person, we request that it not be used for commercial purposes. So of course, we want patient organizations to be able to fundraise, but we don't want private companies to make money off of our cause without giving to them. Some more pictures. So this is events. So this giving these communication materials and making them available is that around the world, this year we had Bolivia, Bangladesh, Madagascar. I mean, it's just amazing. And they were able to create their own events and use those materials. And you can see in these pictures the different creative ways people have done so. Every year there's a different theme and slogan that's very strictly organized. So Rare Disease Day is on the rarest day of the year, February 29th. It comes only once every 4 years. And then when there's not a leap year, it's on the 28th. The idea is that, so the way the theme and the slogan are organized is that between leap years we have an overarching theme, and then which lasts for the 4 years, and from that overarching theme we pull a theme which again is democratically decided in several steering group phone calls, and then it goes on to deciding a slogan. Doesn't take any money, these are ideas. And now that our awareness campaign your awareness campaign has gotten a little bit more mature, in the last 3 years we've had a video, and this is a very important communications tool that was especially successful this year. We had over 1.5 million people watch the video just on EURORDIS social media. So that does not, we made the video available again for all patient organizations to share, to take, to use. So the over 1.5 million doesn't even count what everyone else did. This is our website where patient organizations, and we ask patient organizations to write in and give us their events and information so they can talk about what they've done. And we invite patients and family members to come and tell their story, exchange, take a photo, raising and joining hands, and we encourage interaction and participation. So, of course, as far as budget concerned, yes, a website costs money, but building social media pages doesn't, and all the theme and slogan I said earlier. Just to make sure you all know about how you can use existing campaigns, Rare Disease Day being one of them. So again, there are print materials which can be easily downloaded on our site. They're free. You take them, you get your local partners, you put your partners on the poster and print it, and you have it at your events. You can use our website by uploading your event as a place where people can go and find information where to attend in your city. You can use the media section where we give information about the theme, about the slogan, about ideas of what you can talk about how to approach media, what is going to be happening on that day. I can't emphasize enough to team up with other patient organizations. Okay, so talking about social media earlier and the online communities, you'd be surprised at how many other patient organizations out there are looking for people to team up with to build communication and work together. Again, you can circulate the video. And the key of using Rare Disease Day, I can't emphasize it enough, or using international campaigns. It's not about, oh, I got your email, I forwarded it, or on social media, I forward. Just take a step back, think about, what are my objectives this year? Okay, do I want to be in the media more to get the general public to be understand more about what my diseases are and what my families are living? Do I want my politicians to recognize the importance of a policy that is going to be signed around that day, or what is your local objective? And then take that day. You know that on February 28th you have a reason to call media because it's Rare Disease Day. So you already have your story. But then you fill the objective that you're looking for. That you want to, either you want to fundraise, so you've created an event around, I don't know, maybe you've organized a walk or a run where you want to fundraise. So organize that walk or run around the 28th so you can get in more media because the focus on rare diseases is around that day. Or, of course, your own awareness day. Okay? So again, how to build an awareness campaign. Main idea is to first find a network of people or of organizations in your disease area, common communications materials, along with the day, since the media is focusing already on the day, find your hook. And we've had two excellent presentations earlier about how to deal with media and how to find that hook. And the interaction with, and allow participants to interact either on social media or on the website. And try to engage a variety of audiences. This is your excuse. This is the day that you can do that because your disease is in the spotlight. Think about asking policymakers for a meeting. Look, meet me on this awareness day, and maybe the media will be talking about it because I'm sure to get media on that day, and they'll say that, look, you care about healthcare, you care about people, so let's set up a meeting, and then you talk to him or her about your objectives and your own agenda at that time. But that'll get you that meeting, possibly. So how to start, find a date, okay, and make that date, again, the media hook, possibly make it tie in with something that's specific to your disease. Could it be the birth date of the researcher who discovered your disease, the day that a therapy was authorized, you find it. Somebody among the 18 countries that were the original national alliances for Rare Disease Day, somebody said, let's make it the rarest day. And that's how it became the 29th. There are several people who claim to be that person, but anyway, somebody did. It was a good idea. Build a community of patient groups, again, I've said that already, and create communications tools that everyone will share, again, free of any private company logos. This is very easy. The communications materials like logos, again, the slogan is just thinking, it's just thought. And the info pack, we did it originally on just a Word document that we sent around. It doesn't cost anything. Just yesterday or the day before on Facebook, I saw another mother asking, hey, does anybody out there have a graphic designer or know somebody who would create a logo for us? So even logos today you can create without cost. And then when it becomes more mature and now the media have this rendezvous and you have a network of patient groups and it's becoming more and more well known, this is where you can do a little bit more possibly, and where we have had the success of finding private companies who want to participate by giving, by offering in-kind services. So again, our video for the 2 years out of the 4 that we've now done videos is done by Carlo Hinterman, who's an Italian producer who is very, very successful. He's won awards for documentaries in Italy. He just believes in the cause, and he gives his time and his creation to build the Rare Disease Day video. And at the same time, it gives him exposure now that it's so big, so widely shared and known, and his name, he's done documentaries for rare diseases. So my final picture is my son. I'm just so happy to be able to work for a cause that also affects me personally. So any chance I get to brag about him, I use it, so please excuse me. But that's his picture. And today's a special day for Angelman syndrome because I'm talking about Findacure. They've announced clinical trials, second phase of clinical trials for Angelman syndrome today, the Angelman Syndrome Foundation in the US and Angelman Syndrome Therapeutics also in the US. So exciting times for Angelman syndrome. Thank you.